So then now we're going to move on to just prevention. So as I already mentioned, along with prevention, you are looking and doing regular skin checks. This would be particularly important if, going back to risk factors, you have a lot of unmodifiable risk factors. So, doing skin checks regularly, if you have a family history, would be really important. So skin checks is one of them. Another way for prevention is also your sun exposure. So the worst time of the day is midday. Basically, that's when UVA and UVB rays are the worst. So typically between the hours of 10 to 2. Hi, Nicole. Thanks for watching. Rocky's here right beside me. You can't see him right now, but just minimizing your sun exposure. So that may mean either staying out of the sun completely, being in the shade, and along those lines, other prevention recommendations would kind of still fall under minimizing your exposure to that UVA and UVB light. So wearing a hat, particularly wearing a wide brimmed hat that covers more of you, keeps you in the shade, wearing sunglasses that block UVA and UVB light. So interestingly, and I think this is a super interesting topic, but melanoma actually can affect areas that aren't sun exposed. So you can get them in your eye. People of color often need to actually check underneath their fingernails. And then there are other areas that don't see the sunshine where you can get a melanoma. So I do think that's interesting, but that's just a side note. Obviously an area that needs to be further studied. So minimizing your sun exposure would also include wearing sunscreen. So the recommendation is to wear up to an an SPF of 30. And then, did I forget anything? The last thing would be not using indoor tanning beds. I will say, interestingly, so I've never personally gone to a tanning bed, and you'll kind of understand why later, but I have had friends that will only go to a tanning bed in preparation for a vacation, in an effort not to get burned. So, that's a hard call right there, because if you're trying to prevent yourself from getting a burn, but you're minimizing your time in the tanning bed, I mean, in a way, if you're not getting that burn, I don't know. I don't know if there's a hard and fast rule for that one, but overall, you're not going to a tanning bed just to go to a tanning bed just to increase your tan. So the next thing I'm gonna say is more about sunscreen specifically. So, and this kind of a little bit is about me and kind of getting ahead of the topic, but I've mentioned this a little bit before, but I'm of the mind that, I definitely take a holistic approach to things. I do really believe that food is medicine. I think how you treat your body, if you're looking for optimal health, you're looking at what you're eating, you're looking at what you're doing, whether you're being sedentary, whether you're exercising. That also includes, your environment, what you're putting on your skin. If you think about your skin, it does absorb the things you put on it. I mean, think about transdermal patches. So that's definitely real. So understanding and realizing and being aware of your sunscreen. So if you're not aware of EWG, Environmental Working Group, I do think it is a great resource. They have a database called Skin Deep that is basically, it's a database of different products and kind of talks about the good, bad, and the ugly of these different products. But so I am gonna let you know some of the recommendations that they have in regards to sunscreen. So the no's that they recommend, so you're wanting to make sure you don't have this with your sunscreen, is they don't recommend SPF over 50, which is a little bit surprising maybe for some people, but basically found that anything over 50, you're probably either wasting your money. So if you are paying more money for over 50, but that it's not really any more effective than anything really 15 to 50 is kind of the recommendation. But then also that some people have this misconception in their head that, hey, I'm using 100, that's even better than 50, so I don't have to be as diligent, or I'm getting more protection, and that's just really not found to be the case. The other one that I thought was interesting was they don't recommend spray sunscreens, which I do actually use or have used, particularly as I'm often putting sunscreen on completely by myself, which can be hard to, reach certain spots. Sorry, I'm just gonna try to read this. I don't know if I can read the whole thing. Hey Lisa, thanks so much for sharing. I can't, it says see more and I can't tap on it, but I'm gonna come back to it. So, but thank you so much for sharing that with me. So I was talking about spray sunscreens. They don't recommend use of spray sunscreens, which like I said, I use them because I can't reach like my back. So if I spray it, which is probably partly why they don't recommend it, is that maybe you're not getting the best coverage really and truly versus rubbing it in. But also if you think about it, it's a spray. So we've been, aware about particles and aerosol, and that it may be traveling into areas that you don't want it to, such as like your nose. So the chemicals that are in the sunscreen, you're getting them in even other areas that you don't want them. And then the other no's are basically a certain particular chemical called oxybenzone, which if you're at all familiar with what, I'm gonna butcher the term, but there are certain sunscreens that are considered to be reef safe. Oxybenzone is one of those chemicals that can affect reefs. So if you're in certain areas like Hawaii, I'm sure Australia, that they really and truly want you to use those reef safe type of sunscreens, because that really and truly is affecting the integrity of the coral reef. And that's just sad that, we, by the choices that we make with the products that we're using, that we're destroying natural things like coral reefs, but that's another topic. So, but that is one recommendation, is to find things that don't have oxybenzone. So looking for a reef safe one would be a good option. And then the other two recommendations were just not having retinol palmitate, and then also interestingly, not having a sunscreen with added insect repellent in it. And then they do have, recommendations in that just some of the things that I already said, wearing a hat, minimizing your exposure during midday. Their recommendation is between an SPF of 15 to 50. And then the active ingredients that you do want to look for are zinc oxide or titanium dioxide, which also, again, coincide with being reef safe. Interestingly, I will say that those typically, so that's a mineral-based type sunscreen versus more the chemical-based. They are a little harder to rub in. So if somebody can find better options, that would probably be an area that would be a moneymaker. So anyway, and then the other recommendation would just be to use a lot and to reapply it often. And so for me personally, I would say that, like, I've definitely had sunburns growing up. I spent a lot of time in the sun, still do to a degree, maybe not as much as I used to. But the issues that I've had when I've had a sunburn would kind of fall under two categories. I actually am really diligent about putting on sunscreen for a reason. But I would say is reapplying it often, like you apply it, always good about doing that, but then remembering to apply it regularly and not really like within a day's time, it is more than twice. So, and then particularly if you're in the water, you're reapplying it. And then the other piece that I would say, I most often get burned in areas that you think you've got it covered, but you don't. So particularly as a female wearing a swimsuit is you just want to make sure you lift up on the straps, get it underneath the strap, and make sure you're thorough about it just because the strap moves. And so most often if I get a sunburn, it's in one of those areas. So anyway, that's my topic for today.